Good afternoon, everyone, and thank you so much for joining us today for really what is perhaps the most important conversation that we're having in America. And it's a conversation about gun violence. My name is Joseph Sakran, and I'm a trauma surgeon at Johns Hopkins Hospital. I'm the vice chair of the Brady Board. And I come to this conversation not just being someone who takes care of these critically injured patients on a daily basis, but as someone who's also a survivor, like some of you on the call. And I think having that vantage point, I think makes this fight that we have been trying to tackle, some of us for decades, incredibly personal. And today we have just a wonderful group of individuals that have really come together from very different walks of life to be able to share with you why this is such an important issue and how this really requires all of us to be part of this solution in order to make communities safer. You know, the past few weeks have, of course, been tragic and heartbreaking. And I think it's a reminder that as members of the community, we have a responsibility to work together across sectors in order to cut across these deep-seated problems that we have as it relates to gun violence in America. And the mass shootings, represent one facet of this complex public health problem. But I think we can't forget that every day in cities like Baltimore and Charleston and Philadelphia and Chicago, we have young brown and black men that are being slaughtered on our streets. We also, I'd be remiss not to mention the fact that this also has impacted hospitals, the people that are caring for injured patients. We saw that most recently yesterday with Tulsa and in Ohio. Some of you probably didn't hear about Ohio because it was overshadowed by the other mass shooting in Tulsa. Only in America, right, would you have a scenario where one hospital shooting doesn't get covered because you have another, perhaps, more tragic mass shooting that's occurring at the same time. So we're going to get into some of these discussions, and I'm so excited to be able to talk to just an incredible group of individuals that you're going to hear from here. Before we start, I just want to thank Vote Mama US, who helped sponsor this, as well as Healthcare Awareness Month. There were a number of people, Liuba Grechen Shirley and her incredible team, especially Louisa Duggan, of course, Pete Morley and Rachel Brody, and as well as our other, panelists, right? Fred Guttenberg, who needs no introduction, and orange ribbons for Jamie, Paul Murray from Newtown Action Alliance, who we're going to hear from, who's currently in DC doing this work. And of course, last but definitely not least, my friend and pediatrician, and the next Congresswoman from Charleston, South Carolina, Annie Andrews. So without any further ado, I'm gonna turn it over to Rachel Brody, who's gonna introduce herself, as well as give a brief overview of Healthcare Awareness Month. And then we're gonna hear from each of our incredible panelists and have, I think, a terrific conversation. Rachel?
Thank you, Joe. So Healthcare Awareness Month is a project that was born out of Peter Morley's activism and advocacy. Last summer, he and I decided we were going to do a project to lift up the work that was being done on healthcare in every sense of the word, not just going to the doctor, but things like gun violence that impact health in this country, with the goal of helping get better healthcare for everyone. So it's been a really collaborative process. We've filmed videos with members of Congress, with some of the incredible advocates who are on this call. And we're really excited to be able to be part of this panel and have worked with Vote Mama and everybody who's come to speak today. So thank you all for your generosity and your time. And thank you everybody who is attending this panel. It's really important that you're here.
Oh, Joe is muted.
Sorry, I couldn't unmute myself. Someone muted me, which is probably a good thing. We're gonna hear from each of our incredible panelists, and usually I think the tendency would be for me to start with someone who I'm super close with and know very well. So I'm going to do the opposite. And let's hear first from Liuba Grechen Shirley from Vote Mama. Can you tell us a little bit about yourself and give us a brief overview of Vote Mama PAC?
Yeah, thank you. I'm Liuba Grechen Shirley. I am a mom of 3. I have a 2-year-old, a 6-year-old, and a 7-year-old. And this is the first week that they are really aware what's going on in the country. And it's been a really, really hard week talking to them about it. I ran for Congress in 2018 against Peter King. And after that campaign, I launched Vote Mama PAC because we're missing a critical voice in Congress. Out of all of our congressional members, only 7% are moms with kids 18 or younger, and we're missing that voice. And I launched Vote Mama PAC to support Democratic moms running from school board to Senate. We have also launched Vote Mama Foundation, which is our research and policy arm, which is working with legislators across the country to pass family forward legislation. And by the time you realize how badly our policies are, you're usually a new mom and you don't have time to go out and fight for systemic change. And yet those are the exact voices that we need actually fighting for smart policy. And right now in this particular issue, Republicans refuse to take any action. And there is only so much that we can advocate. We actually have to change who has a seat at the table. So we are working to support Democratic moms across the country who will pass legislation, who will actually protect our children. And that is what we do. We are so proud to partner with Healthcare Awareness and to be here with these incredible advocates. And we need to change this. We need to change this for our children. I was listening to Eric Swalwell today in the markup hearing, and I mentioned a mom from San Francisco whose child, her 6-year-old daughter, asked today, "Which photo will you use for me?" And I was on a train when I watched that, and I started to cry. And that is what our children are thinking. Those are the questions that our kids are asking, and it's enough. So I'm here because I want to support really great candidates like Dr. Annie Andrews, who's one of our candidates, and I want to learn what more we can do to change this and to fix this. Thank you.
Hey, thank you so much. And we're, of course, going to hear much more from you as you're one of our panelists. And before we get into that, let us hear a little bit of an introduction from each of our panelists. And I want to start with Poe Murray. Poe, welcome from DC.
Hi, everyone. From Rosa DeLaro's conference room. I got involved in this movement because my neighbor shot and killed 20 children and 6 educators nearly a decade ago. And we formed an all-volunteer grassroots national gun violence prevention group. And we've been trying to create the cultural and legislative changes that are so necessary to save our children and our families from this epidemic of gun violence. Sadly, during the last decade, I have met too many survivors. And now many of them are my friends, like my dear friend Fred and Joseph and so many others across the nation. We've worked really hard. We've used our unapologetic voices, and we've been really hard on even our friends, the House Democrats, House Senate, even our president. And for the last decade, we've been pushing for a comprehensive strategy to end the crisis, because for 3 decades, we've not been able to pass a single federal legislation to combat this crisis. And as you all know, it costs the taxpayers, survivors, families, communities, and the states $280 billion a year. That's the cost of gun violence, and we're all paying the price. But no one's paying the price more than the families whose children and their loved ones are taken so tragically, as it happened in Uvalde and Tulsa and Buffalo and in Black and brown communities all across the country on a daily basis. So I'm here today with Kristen Song, who lost her 15-year-old son to an unsecured gun. When he went to visit his best friend after he had his braces taken off several years ago, they were playing with the guns that were in a shoebox. And unfortunately, he was shot in the head and he died immediately. So we passed Ethan's Law in Connecticut, and we set out to pass Ethan's Law on a federal level. 2 years ago, around this time, we came to Rosa DeLaro and asked her, will you sponsor Ethan's Law? And since then, we pulled together a survivor group strong women and gun owners to lobby for Ethan's Law, which really paid off, because when Uvalde happened, we were prepared with votes. I mean, Ethan's Law had the votes to pass in the House of Representatives, even without the tragic incident. But now, today, in the House Judiciary Committee's markup of a bill called Protecting Our Children Act, or Protect Our Kids Act. And it is a omnibus bill that will raise the purchasing age for assault weapons from 18 to 21. It would outlaw high capacity magazines and bump stocks. It would subject ghost gun purchases to background check requirements. It will crack down on gun trafficking and straw purchases, and also strengthen safe storage requirements. Ethan's Law being one of them. And next week, there will be votes. There will be a vote on the federal extreme risk protection order that Lucy Macbeth has introduced. And then there will be a vote on the omnibus bill, Protecting Our Children Act. And then just yesterday and today, Speaker Pelosi signaled that she wants to bring the assault weapons ban for a vote on the floor. So that has been my baby since day one. I have been.
Yes, it has.
Yeah, I have pushed the entire gun violence prevention community very, very hard to support assault weapons ban. No one thought that we could get here to a point where House Democrats would support such a thing. But Adam Kinzinger and Chris Jacobs from their Republicans, they signal that they may support it as well. So hopefully it will be a bipartisan bill. So finally, after a decade later, after my neighbor killed those precious children, I feel like we're getting some movement. Senator Blumenthal, Senator Murphy, our senators from Connecticut are working really hard to negotiate with the Republicans on something that can move through the Senate. But you know what? If they don't, then we are going to have a vote, and then we're going to hold them accountable, because about 50 senators will be holding our entire nation hostage by not passing these common sense gun laws. So I'm really pleased to be here with all of you, because it will take a village for us to do that. We're going to have to get the vote out. I know Fred's going to talk all about this, because at the end of the day, we need to make these members of Congress more afraid of us than the gun lobby, and we're almost there. So thank you for having me.
Thank you so much, Po. And we are so many incredible points that you brought up that we're gonna get into and peel back those layers. But let's get through the introductions first. And I'm gonna go to next Dr. Annie Andrews, a pediatrician and currently a candidate for Congress. Annie, can you introduce yourself to the group?
Sure. Thank you, Joe. It's good to see you. Thanks for having me. So I am Dr. Annie Andrews. I am a pediatrician at the Children's Hospital in Charleston, South Carolina. And I'm also a mom of 3 school-age kids. My kids are 10, 7, and 5. And after the Parkland shooting, I had enough, and I joined Moms Demand Action and got incredibly involved in the gun violence prevention movement. And it has since become my #1 passion. I am a clinical researcher, and I shifted the focus of my clinical research to gun violence prevention. So every day I'm fighting for a safer, brighter future for my kids and everyone's kids. And I have the opportunity to replace an NRA A-lister who currently sits in Congress and represents me in November. And that's what I'm here to do. So thank you for having me.
Thank you so much, Dr. Andrews. And I'm so excited to really talk about, some of the stuff that you're seeing, especially as it relates to the kids that you take care of. And I know Charleston has had some really difficult times, especially this past week. So we're going to get into that. And last, but definitely not least, my dear friend, Fred Guttenberg, who, as he says all the time, him and I should have never been friends, which is a true statement. But I'm so grateful to know him and for his voice, and for the fact that, you can have a father who takes, so much pain and anguish and has turned it into action, into something that has been so positive and inspiring for so many Americans. So it's really, Fred, as always, just an honor to be with you. And I know most people probably know you, but why don't you introduce yourself to the group and tell us why you're here?
Well, I love you, my brother, but it's true. I hate that I know you. Poe, I love you, but I also truly hate that I know you. And Peter and Dr. Andrews, who I've gotten to know, I wish I didn't. There's only one thing that has brought all of us together, and it's gun violence. Joe, you mentioned the two shootings yesterday, but two different hospitals. And one made it on the news and one didn't. And the reason why one made it on the news is because people died at one, people didn't die at the other. And that's, it is.
I think actually two people ended up, I could be talking about the one in Ohio. I think two people ended up dying.
Okay, so later in the day, but then it
later
was
in the
like
day.
old news.
It was,
Okay.
there was a lot more that were injured. I think there was 4 that were killed and maybe even a handful others injured there. So I think what you're saying is it was a greater travesty than what was happening.
Listen, that is the craziness of America today. It's at the idea that certain shootings won't even be newsworthy anymore because there's just so many of them. And I just, listen, for those of you who don't know me, I'm going to give you the quick version. On February 14th, 2018, I was just a goofy dad who sent 2 children to school to do what parents across America do every day: send our children to school to be safe and to learn. That's all that I did on the day of love, Valentine's Day. And later that afternoon, just after 2 p.m., before there was any public news, I got a phone call from my son telling me that there was a shooting happening at the school. And my son is a bit of a jokester. I didn't even take him seriously at first until he said to me, "And I can't find Jamie," because he watched after his sister like a hawk and he wouldn't mess around with her safety. The second he said that, I knew he was serious. And I asked him where he was. He told me they were telling all the kids to run from the campus, but he wanted to turn around to find his sister. And I will tell you, I had to literally argue with my son to keep him running and not turning, because he really did want to turn around and run back into that building to find his sister. And if he did, I would probably have 2 dead children. While I was on the phone with him, my son says, "Dad, there's more bullets." And those are the ones on the 3rd floor that were actually killing his sister. That's why I do what I do today, because gun violence isn't only about those who are killed and those we bury. It is about everyone else as well. It's the collateral, it's the families, it's the siblings, it's the kids in the school or in the workplace who witness what happened. It's about the cost to the community and all the members. And excuse that noise in the background. My dog is trying to break out of my room right now. But she just successfully did it. It's about these community costs. Oh, you mentioned the dollar amount. The truth is, there's a community right now that requires food and resources. Actually, more than a community. I'm thinking just Uvalde, but all the others. And it's what I call the Second Amendment tax. That cost to America is being paid by somebody. And so, as I've been watching these markup hearings today with pride for those on the Democratic side who are fighting for our families and our kids, but anger at those on the other side who truly made it clear they just don't care, it has become incredibly clear to me what we need to do and where we are. And so I'm going to end it there. Here's where we are. If you would have told me 4 years ago that we'd be in a place today where we have a House of Representatives that supports what we need to do to reduce gun violence, and a president who will sign the legislation that we need to sign to reduce gun violence, and a Senate that is halfway there, 50 people, that supports what we need to do to reduce gun violence, I would have told you no way we would be in this great a place, in this much of a place compared to where we were 4 years ago. But here we are. The problem is the world has changed along the way. And so politically, we are closer than we've ever been to getting this done. We are 2 votes away. That's all that it will take to break the filibuster. 2 votes. We're also only 7 votes away from going back in the wrong direction, and we can't let it happen. I love Senators Chris Murphy and Senator Blumenthal. They are working to get this done, but it's not going to happen. I have no faith in the Senate to actually find the 10 Republicans that are needed, let alone 1. Mitch McConnell still hasn't even said the word gun in the past 2 weeks. And Senator Rick Scott is running as fast as he can from Governor Rick Scott, because Governor Rick Scott was a leader after Parkland. We passed legislation, but Senator Rick Scott wants people to forget Governor Rick Scott. And so we need a political solution. And I am not going to buy into the conventional wisdom. In fact, I think it's already changing. Here's how we solve this, finally. Because the past 2 elections have put us on the course to finally getting this done. This election in November is the election that will close the deal if we show up and vote. So for all of you who have any reason where you think you might want to sit home, you cannot. You have to go out and vote. We need to send Dr. Annie Andrews to Congress, okay? Because we can hold the House, but you have to go out and vote. And let me tell you something. If you haven't started working on your voting plan yet, do so now. Don't wait until October or November to try to figure out, do I have all the registration I need? Am I even registered? Am I going to have a hard time or not voting? Figure it all out now so there are no questions to ask later. But be ready to vote and show up and vote. Thank you all. I love you all.
Yeah, thank you so much, Fred. And it's such a great point that you and I have discussed, many times again. And I would just say that we're probably preaching to the choir in regards to the people that are on this call, but each one of those individuals, right? Each one of you have the ability to impact your networks and to put those plans in place as Fred nicely articulated. Before we get to kind of the policy stuff and the brass tacks, so to speak, I want to take it a step back, and I want to start with Dr. Andrews. Because I think sometimes what gets lost in this conversation as we talk about numbers and statistics is we forget the fact that these are actually people, right? They're human beings, they're loved ones, they're members of our community. And I think it's very important not to forget that. And Annie, I was talking to someone the other night, and we were talking about the fact that, like, imagine what these parents, right, in Uvalde must have gone through, right? 19 children massacred. And not only were they told that their son and daughter was never coming home again, but they had to identify their child, many of whom probably were not recognizable. Why do I say that? Well, the parents were asked for DNA tests. And I think that's one demonstration of how horrific the injury patterns were. As a pediatrician and as someone that, works in this space, can you kind of help us? And I know, these details are hard to hear, but I think, as Julia Kayam, one of my former professors from the Kennedy School, said the other day, we have to stop sanitizing, what's happening in America. I think the American people need to understand what we as healthcare professionals see on the front line, but like what is like literally happening to, these young people, adults, when they are shot and when they're experiencing these devastating injuries. So maybe you can kind of help us understand that.
Yeah, thanks, Joe. I mean, it's true. When I decided to be a pediatrician, I never considered that I'd be caring for so many children who had been shot. But over the past 10 years, it's become increasingly common. And so just to paint a little bit of a picture, so I walked in a room of a child about a month ago, and he was a sweet little 4-year-old boy sitting up, eating pancakes, using the banana on his food tray as a telephone, high-fiving one of the staff members in his room. But if you looked closer, you could see that he was actually strapped to his wheelchair, and it was his speech therapist feeding him his pancakes. And the reason we were high-fiving him was to see if he had gained any strength in his left arm. And he was wearing a helmet to cover the scalp defect, the skull defect he had, because part of his skull had been removed, because he had accessed an unsecured firearm in his own home, picked it up and shot himself in the head. And this is not a unique story. You know, gun violence is now the #1 cause of death for children in this country. And that statistic should stop all of us in our tracks, because it's not okay, because every single one of these injuries is preventable. And Joe, I know you have a million stories like this. I wake up to texts all the time from residents who are working overnight in the emergency department, because they tell me about these horrific things they see. They tell me about the blood squirting out from the bullet holes while they're doing CPR on children, or what it's like to stand at the head of the bed with someone who has a gunshot wound to the head while they're trying to intubate them. I mean, it is horrific. And every single one of these children had a future ahead of them, and they had a family, and they had a community, and it is preventable, and it is not okay.
Yeah, I mean, sorry, Fred, were you going to say something?
No, I was just going to add something. It's
Yeah,
not
please.
only preventable, the next one is also predictable. And it's because we haven't changed the thing we're doing. And I want to also just say one more thing, because part of sanitizing also involves us understanding how many types of different gun violence injuries are possible. Because my daughter, it was one AR-15 shot, and her body wasn't blown to smithereens, but it severed her spinal cord. And so, Dr. Andrews, you want to know, as her parent, my anxiety that I'll live with for the rest of my life. Because her body wasn't blown to smithereens, I fear she survived even for a few seconds and suffered. And so if people need to understand my anxiety and what drives me to never stop, it's because I fear my daughter actually survived for a period of time and suffered. And so, you know, I'm so glad to hear the two of you ask and answer this question about, you know, what this actually looks like on the body. But the next one, my friends, if we don't show up and vote, they're going to keep happening. Next time it might be someone you love.
Yeah, I mean, I think Fred and Annie, thank you for those comments, obviously. And Fred, that's the thing, is that people, you know, no one ever thinks it's going to happen to them. Everyone is like, you know, it's almost like we're kind of complacent. Like we see it happening and no one ever thinks it's going to be their community, their school, their place of worship, their, concert hall. But if one of us not safe, none of us are safe. And, Luba, this kind of gets me to thinking, I mean, of course you ran for Congress, but also you have this incredible organization that is mobilizing, folks. Like, how do you, like, what's kind of like some tricks and tips that you have used to help people understand how important it is to support candidates like Dr. Andrews and to be out there and to make our voice heard? Because I think one of the things, when you look at like the low voter turnout rate in this country, one of the reasons is because most people, they don't believe that they themselves can make a difference. And I think if all of us change that mindset and realize, no, actually we can make a difference. And we've seen many elections where it's come down to, even a couple hundred votes. Can you tell us, like, how do you connect with folks and make them understand that and describe that narrative and use your own experience to get people, to understand how critical they are as part of this process?
To personalize politics. And this is, I think, what I was not a politician. I was not planning on running for office. I was just really angry and had this representative who had been my representative since I was 12. And I ran with a 1-year-old and a 3-year-old. And I had no political connections. And I built this massive campaign because we were talking to people about the issues. And that is what a lot of people don't understand, that politics is truly personal, and they get complacent and they have a representative who's been there forever and they don't feel that they can run against this person because the establishment is behind them. They've raised so much money. They have millions of dollars in the bank. But when you actually start talking to people about the issues and you make them understand that they can have power, that they can organize, that they can vote, that they can support a candidate and get involved. We mobilized hundreds of thousands of people on Long Island, which is the place that a lot of people don't think their vote matters. And that is what has to happen across this country. We have too many people who have been in office for decades who just sit there and don't really have to fight. But if we get more moms to step up and run, and that's one of the things that we're doing. So on the PAC side, we endorse these candidates, we fund them, we mentor them, we coach them, we get them into office. But about a year into running the PAC, I realized that there's only so much you can do to try to convince moms to run and to support them when they're doing it, if we're not actually breaking down the cultural and structural barriers that keep them from running in the first place. So for instance, you want to convince more people, more individuals, the people who are not, the old boys network and the political network and the people with the millions of dollars. You actually have to break down some of the barriers. We're passing campaign funds for childcare so that candidates are allowed to use their campaign funds for childcare. That is a very small structural change, but it has the ability to transform the political landscape and to get more average working class people who have been affected by the way that these policies actually affect people's lives to step up and run. We are launching a membership arm of our organization to get people involved and to make it really easy, because there are a lot of people who are overwhelmed and don't know where to start. And we want to give them kind of bite-sized pieces of activism. This is a candidate who's running for office. This is how you can volunteer. This is how you can make a donation, go out and knock on doors, volunteer. This is a piece of legislation that we're working on with these legislators. Here's how you can go and make a difference. You have to make people understand that politics is completely personal and that these votes matter. And there is no reason that these people should be sitting here in office, these 50 senators who are literally holding the country hostage and who are refusing to pass legislation because they are hearing from the NRA, and they are hearing from the moms, but they're listening to the money. And that's what unfortunately is the problem in this country. And so there is no magic bullet. There's no thing that's just going to solve it. You just have to keep talking to people and making sure that they understand that their voices are absolutely necessary.
Yeah, it's interesting that you mentioned that about the NRA. I heard, I was on this long chain the other day and someone said, oh, well, the NRA, they're not really relevant anymore. They're so much weaker. And I had to correct them because yes, are they weaker from a number perspective compared to prior years? Sure. But when you have hundreds of millions of dollars in revenue still, you have incredible influence. And I think, that gets into a whole broader discussion, which we don't have time for, about campaign reform, right? And of course, as you know, 90% of incumbents get reelected, right? And so having campaign reform is very unlikely, because why would someone change a system that's working in their benefit? But we're going to leave that for another day. Paul, I've always been so impressed by your advocacy, by your ability just to connect with so many different people from all walks of life, and to just kind of really roll up your sleeves and do the work. And I feel like one of the things that you've done that has been so important is, I think we forget that most governing in America happens at the local and state level, right? And of course, we have seen, people say, well, nothing has changed. And I think things have changed over the past decade, especially after Sandy Hook. And unfortunately, it's primarily changed at that local and state level, which is good, right? We've seen hundreds of pieces of common sense gun legislation that have passed. Now, as we talk about, of course, we live in a country that has porous borders. And so we understand why we have to continue to push for the change at the federal level. Can you just tell us a little bit about, how have you balanced, navigating between the stuff that you've done locally and at the state level? Obviously, we understand how important that is. And what type of recommendations do you have for people that are on this call that they want to get started, but maybe they don't know what to do or how to get involved?
Well, look, I got involved as an ordinary citizen. I'm actually a trained physical therapist. I stopped working when I had 4 children. So I understand the health impact of gun violence. And it became really important to me when it impacted my community. But since then, I've been urging all others to get involved before it happens to you, because I thought it couldn't happen in my community, but it did. So I think it's really important to, work locally, get involved in getting on the school board or town council, and get elected and pay attention to what's happening, because the other side I truly believe that NRA is just being used by those with political power to just feed the base to retain their power. I mean, that's what it's really about. I mean, they are hammering us with gun issue, with women's rights and our voting rights and many other rights, because they just want to retain their power. And that's why I think it's really important for us to exercise our right to vote. That's first and foremost, the most important thing we could do is vote. And then, of course, there are advocacy groups everywhere, right? We have so many national gun violence prevention groups and also the state groups. The state groups have existed for decades, understanding what laws are needed in that state, and also having great relationships with the state legislators. So it's really important to, keep that fight on the state level as well, because recently there's an effort to pass permitless carry, which they're calling the constitutional carry, and of course, stand your ground. And, it's gaining momentum, which is really scary. But that's on the back of Trump winning and Republicans pushing that extreme rhetoric. And we also have to remember that it's not just the NRA. There is an industry trade group called the National Shooting Sports Foundation. They're headquartered 3 miles from Sandy Hook Elementary School, and they spent as much as the NRA on lobbying Congress against any and all gun laws. So, we hold rallies in front of NSSF. So, new advocates can do just about anything. They can rally in front of NSSF, in front of NRA. They can join organizations to, like Moms Demand Action, like Annie did, and get involved and finally run for elected positions. And it doesn't have to be Congress. Like I said, you can, run for local positions. But most important, and another important thing is like contacting your members of Congress. It's so easy to do, right? They have a congressional switchboard number. It's 202-224-3121. You can call your members of Congress every day and tell them that this is an important issue, because we need to outshout the gun lobby. And we are doing that. We're a volunteer organization, but we have many volunteers who hop on to our lunch and lobby sessions, like Carol Resigno, I see you, and Dawn, our board member. Like, you've been on these lunch and lobby sessions, and we make it really easy for you to call Congress, every Monday from noon to 2 o'clock. So I urge anyone who hasn't done it yet to do it with us, because it will take a village to get this done.
Yeah, thank you so much, Poe. And I'm glad that you have that number memorized. I'm not surprised at all. Fred,
Sure.
look, one of the things that I've always believed is that as Americans, we have a lot more in common than we have that divides us. And it's sometimes hard to see based off like what, we may see kind of over social media. But I noticed this first in kind of going around the country and talking about gun violence and having, gun owners come up to me and say, hey, Joe, like, actually, we agree with like 95% of what you're saying. And what I've noticed, especially recently, is you've built some very interesting kind of relationships, I would say, across the aisle, so to speak, with people, that may have some, conservative views, but you're able to find kind of some of these commonalities. Can you tell us a little bit about, that and how you navigate those conversations? Because I think sometimes, Fred, it's easy for us to talk to people that think like us or behave like us, but really the most impactful conversations are with the people that don't. So tell us a little bit about that experience, and maybe you have recommendations that we can then learn from and also implement in our own kind of networks and lives.
Listen, it's always easy to talk to the people who we agree with, but it's the ones who we don't that we have to talk to. So let me just say it like this. I really work hard to remove this dialogue from the Second Amendment plank, because to me, the issue of reducing gun violence isn't a Second Amendment conversation. It's just not. And so when people who think they disagree with me approach, I ask 3 simple questions. Do you want to reduce the number of deaths related to gun violence? Nobody's going to say no to that. Do you want to reduce the instances of gun violence? And do you want to reduce the severity of gun violence injuries when they happen? once I ask my questions, everyone who I speak to, we're in agreement. Then it's just a question of, okay, so let's talk about how. And that has led me to speaking to, candidly, a lot of Republicans. Sadly, not the ones currently serving in Washington, D.C., because they're a different breed. I refer to them as the Trumplicans, and you're not breaking through. But there's a whole class of Republicans that are more like what was once there, who actually care about America, care about their families, and care about democracy. And they do want to have this conversation. And we need to show that we're talking to them. Because the truth is, we're not, Joe, it's what you said. We're not as divided as many would think. In fact, 80-90% of this country wants this solved. They want this done. It's not that there's division, but in DC, there is a specific group that has decided they are going to be a firewall. And we need to break down that firewall with our vote. Now, let me just tell you, because the NRA piece came up, and it really does get to this whole conversation. It is groups like that profit off of this division, the idea of division, the idea of violence. And so we have to constantly fight back against those groups. Yeah, the NRA is weakened, but they exist. And as long as they exist, they are dangerous. And where they're really putting the bulk of their effort now is on litigation. They're filing garbage lawsuit after garbage lawsuit with the intent of those lawsuits ending up at the Supreme Court. And we're all now waiting for the Supreme Court to rule on the first of those lawsuits that's coming around. So the NRA is dangerous. And as long as they exist, we need to fight them as well as the other groups that exist. So I appreciate the question.
Yeah, well, look, thank you so much for that. And yeah, it's been impressive to watch. And I think it's one of those things where, you know, it is a lot harder to have those conversations. But I think in my experience, and maybe others have had this, you learn a lot from those conversations. And you know, the fact that, you know, those three questions that you ask is so true in so many of the different pieces, you know, social issues that we're facing in America. Is like most people have similar end results. It's just that the difference of how we get there. It's 4:45, and I want to be respectful of the fact that we want to make sure the folks on this call have the opportunity to engage with this incredible group of participants. So if you have a question, please, you can raise your hand or put the question in the chat. We would love to hear from you and have you ask something. Until I see something and until someone tells me that there's something, I'm going to keep asking questions because there's so much to peel back here. Look, I want to go back to you, Dr. Andrews, and I was thinking about, you know, what we're seeing in cities across America outside of, you know, what's often highlighted, which are the mass shootings, and how, you know, in a lot of communities, the recidivism rate, right, the re-injury rate can be as high as 40% over 5 years. In Charleston, you know, you all have faced some of those, you know, very, you know, same and similar kind of difficult scenarios. You've, of course, with Dr. Hank and other incredible people, started a hospital violence intervention program. Can you talk a little bit about the importance of, as communities, working together to kind of ensure that it's not just trying to prevent the deaths, but also, as someone mentioned earlier, there are a significant number of non-fatal injuries. And it's easy to forget those. In fact, you know, for every death, right, the conservative number is probably 2 to 3 non-fatal injuries per death. Last year in Baltimore, we had 728, right? And those individuals are an opportunity, are, you know, individuals that we can engage in when they come through this revolving door. So can you talk a little bit about that?
Yeah, so You're exactly right. And just like Liuba was saying that all politics is local, I mean, gun violence prevention starts at the individual city block level. And that is what hospital and community-based violence intervention programs address. They address the root causes of violence. And I get so frustrated when people on Twitter or on TV just, well, you don't have any solutions. They throw their hands up and it's like, we have evidence-based, cost-effective solutions that can address this problem at its core without even waiting for Congress to pass laws. So like you said, I work with Dr. Hink, who started a hospital-based violence intervention program in Charleston, and these programs work to address the root causes of violence to prevent re-injury. So when a patient shows up in the trauma bay having been shot and is lucky enough to survive that injury, they get these wraparound services delivered by client advocates who act as social workers, essentially, who leave with the patients as the patients leave the hospital. They leave the hospital walls. They, job training programs, addiction services, find housing, address food insecurity, all of these things that are the root causes of violence. And it's just, I know that you know this, but it is so frustrating because the solutions, the answers to the test are right in front of us. We just don't have leaders who are willing to invest in these programs or leaders who are willing to get serious about implementing these common sense solutions.
Yeah, that's such a great, it's such a great point. Liuba, did you have a comment? I saw you raise your hand.
No, I have a question, actually.
Yeah.
May I ask a question?
Yeah, sure can.
I guess this is for Poe or anybody who would like to answer, but where are we on the conversation of repealing PLCA? Because when Bush signed that into law, literally the NRA said this is the the most helpful piece of legislation that anyone has passed in the last 20 years for NRA, for the gun lobby. And I know that there is conversation about it, but is there conversation? Are they talking about it today? What is being said? Where are we on that? And how do we repeal that?
Yeah, who wants to take that?
Oh, you
Oh,
want to
Fred.
go first, and then I'll add.
You need to be unmuted. Poor Poe, she always keeps getting
All
muted.
right. So then I'll go first, and then Poe can add. Listen, Poe and I and so many others are working our tails off to get this done. Simply put, nothing will change this conversation more than getting CEOs of these companies under oath to have to talk about what they did, the decisions they made. There's nothing I want more. Now, I personally, since my daughter was killed, in fact, I'm the only family from Parkland who chose to do this, have an active lawsuit against the manufacturer. The reason I'm the only one who chose to do it is because of the potential risks to me in doing so. Because the way PLCA is written, these companies can come back and hit you hard if you fail. In Florida, there's a law that's even more onerous than PLCA. I'm still working to get through that before I can file the federal claim. But at the end of the day, all that I want is to put CEOs under oath. Because of PLCA, what we did do is file what in essence would have been our lawsuit as a Federal Trade Commission complaint. And Representative Carolyn Maloney is actually getting ready to hold hearings now, pulling all this together that are going to lead to subpoenas to these CEOs of these organizations to get them under oath. So hang tight. That said, PLCA should be repealed. And there are members of the House and the Senate who agree with that. I am hopeful that we will see some of those members arrange for some hearings to eventually go there, but we're not there yet. I also just want to say one quick thing. I saw a comment in there about the Senate filibuster. For those who want to break the filibuster, it comes down to November. We need 2 more senators, 2 more. So anyone listening who lives in a state where you have the potential to help add one of those 2 more senators or hold on to a senator that we need to hold on to, make sure you vote. Poe?
Actually, if I can just jump in, we do have another question. How do you respond to people who say gun laws won't change gun violence, or bad people will always find ways to get guns and restrictive gun laws to harm the good people?
You know what? I can take that.
Yeah, go ahead, Poe.
I'd answer the PLECA really well. So yes, we are going to work with Senator Blumenthal and Adam Schiff to continue to repeal PLECA. But meanwhile, the Sandy Hook families were able to break through PLECA with the help of Josh Koskoff, a lawyer, one of my friends from Westport, Connecticut. So, there is a pathway to hold the gun industry accountable, but we definitely need to repeal PLECA.
And in certain states, Connecticut law made
That's
that
right.
more viable than, for example, Florida, which is why we need to ultimately address it at a federal level.
Yeah, absolutely. Now, I'm sitting here, at the hearing on Protect Our Kids Act, and the other side, that's our argument, right? You are going to disarm law-abiding citizens, and gun laws don't work, and blah, blah, blah. Well, those are all lies. I actually was born in South Korea, and I came to this country when I was 9 years old. And I didn't realize this, but I did some research into gun laws in other nations. And South Korea actually used to have a gun violence problem. But they passed a set of strong gun control laws, and guess what? There are nearly no gun deaths any longer. And same with Japan. And then there are other nations, right, that passed strict gun control laws after their tragedies, like Dunblane. And then Australia, New Zealand. So other countries have addressed it, and they don't have mass shooting crisis and everyday gun violence like we do in this country. So the other side will tell you that gun laws don't work, but that is not the case. And plus, we have 400 million guns in this country, right? We should be the safest country in the world if their argument is that we need a good guy to stop a bad guy with a gun. But we saw what happened in Uvalde. The good guy stood outside and waited for the kids to get slaughtered. So that is just, false argument. But they will continue to use these lies as long as they think that they can get their base out to vote for them. It's about maintaining their power.
20 seconds.
Yeah.
A, be okay with calling a lie, because it's a lie. B, when you look at states in the United States that have actually passed gun safety measures, whether it's Massachusetts, New Jersey, California, their per capita gun violence numbers and death rates are lower, full stop. So it's just a lie, it's false, and we need to call it a lie.
Yeah, absolutely. I feel like we need another 5 hours because there's so much I want to get into, and we only have 4 minutes. I want to mention just a couple things, and then we're going to have some closing thoughts from each of you. The first is, in regards to the international piece, Poe, you're absolutely right. And there's a lot of other examples, by the way. You look at Australia, the Port Arthur massacre, and I'm not saying that their comprehensive national firearm agreement is exactly what we would implement here, but the point is that they acted, and the association after that law was implemented was a decrease in homicides by 59% and suicides by 65%, which gets me to a point that I saw Ariel Knox put in the chat, talking about, if his dad would still be alive if when he was discharged, they had taken his gun away. And Ariel, I don't know the whole story, but I'm sorry to hear that. And I would say that the suicide piece, which we haven't really talked about, is so critical because it's, pretty much 2/3 of gun deaths. And frankly, Dr. Andrews and I, right, as healthcare professionals, we don't always see those patients. Why? Because the fatality rate is so high, they don't make it to the hospital. And there are very clear ways and opportunities to intervene in people, that are having difficult times. And who knows, the loved ones better than their friends and family that are around them, which is why when you think about pieces of legislation, there's no one solution. So extreme risk protection orders, for example, are very beneficial in these type of situations where that you have, a family, friend, or loved one that is maybe, experiencing difficult times and they shouldn't be around a deadly weapon. Okay. Each of you have like 30 seconds to kind of give us kind of a final point or takeaway, anything that you want to say, and then I'm going to quickly wrap it up. So let's start with Liuba.
In 30 seconds, I don't even know what I can say. We need to change who has a seat at the table. That's it. There is only so much we can do to continue to ask them to pass common sense legislation. Please find out who the representatives in your district are, who are running, get out and vote for them, and do more than vote for them. Donate to them, knock on doors, volunteer, make phone calls, get your friends involved, because that's the only way we're going to change this. We need to vote, and we need to support incredible candidates, Democratic candidates who are actually going to pass common sense gun violence prevention legislation.
You so much. Dr. Andrews.
Yeah, so I've seen a lot of people say since the tragedy in Texas, is this time going to be different? And this time can be different if moms decide to start voting on this issue. I don't know how any parent or grandparent in this country can go to the voting booth in November and not think about what happened to those 19 babies and 2 teachers in Texas. So I encourage everyone to have conversations that might be uncomfortable with people in your lives about why you're going to vote on this issue and why other people need to vote on this issue.
Some Poe.
I think it's a secondhand smoke moment. I think people are realizing that you can be impacted by gun violence. So I would love all to get engaged in every single way, locally and the state level and federal level. But I also have a message for the medical community. I would like the medical community to be all in, the surgeons, nurses, doctors. We've been urging the Academy of Pediatrics and American Medical Association and the Academy of Surgeons to, support bills like Ethan's Law and assault weapons ban. So I would love to see the medical groups go all in and help us get this done.
Yeah, I couldn't agree with you more. And in fact, this morning, the American College of Surgeons had a press conference, which was really kind of unprecedented for them about this. And I think, they need to be all in. I'm not just talking about surgeons, but the entire healthcare community, because we are, in many ways central to this discussion because we're seeing these patients, we're having to talk to these families. So thank you, Poe, for that. And last, but definitely not least, Fred.
I'm going to actually end it with an ask, with a favor of everybody on the Zoom. And here it is. I want all of you, when you get off this, to go look someone who you love deeply in the eye and tell them you love them as if it's going to be the last time. And when you get done telling them that, I want you to imagine that it truly is the last time, because when you guys go away from each other, that person becomes the next victim of gun violence. And I want you to really comprehend what that feels like. And then don't make another excuse about why you maybe can't vote. I want that feeling to be the only thing you think about between now and November, and to vote on it, because that's what it is going to take. So thank you all for being here, and make sure you vote.
Yeah, thanks so much, Fred, for that. And I would just want to end it with just a couple quick things. First of all, thanks to the sponsors of this, and to all of our incredible panelists. You all are amazing, and I just am so grateful to know each of you and just to be here with you all spending this hour. Tomorrow is Gun Violence Awareness Day, so I'd be remiss not to mention that we want everyone to wear orange. Capture a selfie of yourself or your team, post it on social media. The healthcare community, This Is Our Lane, and others are, of course, going to be active, as I know Newtown and Orange Ribbons and just everyone on here is going to be a part of this. So please participate and raise awareness. And I just want to say that, these past couple of weeks have been really heartbreaking. And I think the most heartbreaking moment that I had was when I heard about this little girl, Maya, who essentially took blood from a dead classmate and smeared it all over herself so that the gunman, if he came back, would think she was dead. Say to you guys, that could be any one of our kids, our nieces, our nephews. And it's just not acceptable. And I just think that we're so much better than this. So we got to do what we can to really be part of the solution. And we can't put the burden of this problem on just a few people, right? We all have to be part of the solution. So, get out there, do what you can. This is the most important public health issue we're facing in America right now. Thank you all so much.
Thank you. Goodbye, everybody. Thank
Bye,
you.
everyone. Thank you.
Bye.
Yeah, bye.